The ferry was 40 minutes late, and he was already pale by the time I found him. I wasn't even supposed to be working that night. I was a passenger, same as everyone else. Coat, coffee, a paperback I hadn't opened in 2 hours because the water was doing that thing it does in autumn, going silver and restless all at once. But I heard the commotion near the lower deck seating, and something in me, I don't know, call it instinct, call it the particular curse of anyone who's spent enough time in clinical training, something just pulled me toward it instead of away. He was sitting with his back against a support pillar, maybe mid-30s, dark jacket, the kind of face that probably looked very composed under normal circumstances. Right now, it was not composed. His travel companion, a woman who turned out to be his sister, was crouched beside him, doing that thing people do when they're scared but trying not to show it. Which is to say, she was talking too fast and touching his arm too much, and neither of those things was helping. "Is he diabetic?" I asked before I even fully stopped walking. She looked up at me like I'd appeared out of the floor. "What? No. He has an autoimmune condition. He's supposed to get his injection every 2 weeks, and we forgot it at the hotel. He brought a backup, but he's never done it himself before. His nurse always does it." She held up a small case. Inside, nestled in a little foam cutout, was a pre-filled syringe, the kind used for subcutaneous biologics, the medication that lives just under the skin, not deep in the muscle, not in the vein. Just in that soft, quiet layer between. I looked at him. He looked at me. "I'm a nurse," I said. "Not on duty, but I can help if you want." There was a pause. The ferry rocked, very slightly. Somewhere above us, a child was running in circles, and someone was telling them not to. "Okay," he said. His voice was steadier than I expected. "Yeah, okay." His name was Marcus. He told me this while I was washing my hands in the small bathroom near the galley, which was not exactly a sterile field, but was considerably better than the open deck. He'd followed me there, which I appreciated. Some patients need to be guided through every step, and some just follow, quietly trusting. And there's something in that second kind of trust that always catches me a little off guard. It's so complete. It asks nothing. It just gives itself over. I dried my hands. I snapped on a pair of gloves from the small kit his sister had in her bag. She was prepared in the way that people who love someone with a chronic condition learn to be prepared, which is thoroughly and slightly anxiously. Good gloves, nitrile. They fit. "Have you eaten today?" I asked. "Lunch, a few hours ago." "Any alcohol?" "Half a beer, 3 hours ago maybe." "Good." I uncapped the syringe and held it up to check the solution. Clear, no particles, no cloudiness. Always check. It takes 2 seconds and it matters. "And you're not feverish? No infection anywhere? No swelling at a previous injection site?" He shook his head. Then, after a second, "You ask a lot of questions." "I'm about to put a needle in you," I said. "I'm allowed." He laughed. It was small and surprised, and it relaxed his shoulders by about 1/2 an inch, which was exactly what I needed. Here's the thing about subcutaneous injections that nobody tells you until you've done enough of them. The location matters more than the technique. People fixate on the needle, the angle, the speed, the depth, and those things matter, yes. But if you choose the wrong spot, if the tissue is too thin or too close to a nerve, or too near a recent injection site, you will feel it. The patient will feel it, and not in a good way. The abdomen is the most common site for this type of medication. The soft area, 2 inches to either side of the navel. You avoid the navel itself. Avoid the waistband. Avoid any area that's bruised or hardened from previous injections. You rotate sites. Always rotate. The tissue needs time to recover, and if you keep returning to the same spot, you get lipohypertrophy, little fatty deposits that build up under the skin and actually reduce absorption. The medication stops working as well. The body is clever, but it's also stubborn, and it will quietly compensate for whatever you keep doing to it. I hadn't lifted his shirt just enough. I found the spot. Soft, accessible, no visible bruising. I pinched the skin gently between my thumb and forefinger to lift the subcutaneous layer away from the muscle beneath. This is important. You're not going into the muscle. You're going into the layer just above it, and pinching creates that little tent of tissue that makes the angle easier and the insertion gentler. Take a breath in, I said. He did. Now let it out slowly. He did that too. And on the exhale, when the body is softest, when the muscles are releasing, when everything is just slightly more open than it was a second ago, I inserted the needle. 45 degrees. Smooth. No hesitation. Hesitation is what causes pain. A needle that goes in with confidence is a needle the body barely registers. It's the tentative ones, the ones that pause halfway, that sting. I depressed the plunger slowly, steady pressure, not fast. The medication needs time to disperse into the tissue, and if you push too quickly, you get a burning sensation that lingers. Slow is kind. Slow is almost always kinder. Then I withdrew at the same angle I'd entered, pressed a small piece of gauze to the site. Not rubbing, just holding, because rubbing can cause bruising. And it was done. He looked down at his own abdomen like he was expecting to find evidence of something dramatic. There was nothing. A tiny spot of pink where the needle had been. That was all. That's it, he said. That's it. His sister had been waiting outside the bathroom door. When we came out, she looked at her brother's face first, the way family always does, reading the person before they read the situation. And then she exhaled. "Thank you," she said to me. And then, because she clearly needed to do something with the relief she was feeling, "Can I buy you a coffee? They have coffee upstairs. It's not good coffee, but..." "It's fairy coffee," I said. "I know exactly what it is. Yes." We sat at a small table near the window as the water went dark and the lights of the far shore started to appear, scattered and warm. Marcus had color back in his face. He was telling me, unprompted, about the hotel they'd left in a hurry, a wedding, his cousin's, 2 days of chaos and celebration, and apparently at least one lost medication case. "You should set a reminder," I told him, "not just for the injection day, but for the day before. Pack it the night before. Treat it like a flight. You don't wait until morning." He nodded. "My nurse tells me the same thing. Your nurse is right." He smiled at that. He had a good smile, the kind that arrives slowly and stays. I want to say something about fever, because it came up. His sister mentioned she'd had a low-grade one earlier in the week and hadn't been sure whether to worry. This is worth knowing. A temperature under 100.4 Fahrenheit in an adult is generally considered low-grade, and if there are no other alarming symptoms, no stiff neck, no rash, no difficulty breathing, no confusion, rest, fluids, and monitoring are usually appropriate for the first 24 to 48 hours. But if the fever climbs above 100.4